Thank you so much for joining our program today called Parkinson's Disease More Than Motor Symptoms. Today we have Dr. McGraw with us. She is a movement disorder specialist at the Center for Neurodegenerative Disease at Northwestern in Chicago. And so Dr. McGraw, if you want to take it from there and just add anything onto that, that would be great. And hopefully we'll get your slides up.
All right, let me try again with the slides. Oh, it looks like they're going to work now.
It will.
There we go. Can you see them?
Yes.
Yes, we can.
All right. Okay. Oh, a little off there, but okay. So as she said, I am Dr. Martha McGraw. I'm a movement disorders neurologist at the Movement Disorders Center at Northwestern Medicine Central DuPage Hospital. We're outside of Chicago, and we have a movement disorders center that specializes in the treatment of Parkinson's disease and other related disorders. I'm here today on behalf of Acadia to talk to you about Parkinson's disease psychosis and about NUPLAZID. So what we'll start with today is a discussion of non-motor symptoms in Parkinson's, focusing on hallucinations and delusions. And we'll talk about what that looks like and how to approach these issues with your healthcare doctor and our healthcare provider and establish a treatment plan. So Parkinson's disease is called a movement disorder, but we know that it involves a lot more than just motor symptoms. So about 1 million people in the United States have Parkinson's disease, and that number is going up as the population ages. And the most familiar symptoms are tremor, slowness, stiffness, walking and balance changes. Those are what we call the motor symptoms of Parkinson's disease. But like I said, we know that Parkinson's disease causes a lot of other problems as well. And for many people, the non-motor symptoms actually cause more trouble than the motor symptoms. And non-motor symptoms are things like anxiety and depression, sleep changes, maybe acting out your dreams, seeing things that aren't there, constipation, urinary problems. So really there's a long list of non-motor symptoms that go along with Parkinson's disease. Today, we're going to focus on hallucinations and delusions. And I'm just going to start off by defining those. So hallucinations are seeing, or hearing, or otherwise perceiving things that other people don't see, things that aren't there. And delusions, that's a little different. It means you're believing things that are not true, despite being shown evidence to the contrary. So what causes hallucinations and delusions in Parkinson's? Well, ultimately, the hallucinations and delusions are due to Parkinson's disease themselves. Parkinson's disease itself is part of the disease. But there are other internal factors that can trigger these hallucinations. A big one is dehydration. Most people don't drink enough. As we get older, we lose our thirst reflex, and we also a lot of times you don't want to have to urinate a lot, and so you stop drinking. You avoid a lot of fluids. Then people get dehydrated and may end up in the emergency room, and or even if they're just at home, they may have more symptoms of confusion or hallucinations. If people have a change in their vision, maybe due to glaucoma or macular degeneration, it's harder to perceive visually what's going on around you and makes you more vulnerable, perhaps, to seeing things that aren't there. Other medical conditions, infections, stroke, things like that can cause hallucinations. And infection's a big one, particularly urinary tract infections. That's probably the most common trigger for hallucinations that we see in our clinic. So a patient will call in, or maybe a spouse will call in and say, oh, my husband has started seeing things that aren't there. And the first thing we say is, let's check a urinalysis. Let's check the urine. And the spouse will say, oh, but he's not having any problems with his urine. Why are you going to check his urine? We say, well, that's often a trigger for hallucinations, even with no other symptoms. Even if there's no pain with urination, or even if there's no fever, you can have a urinary tract infection and the only symptom is confusion or hallucinations. So we always start with checking that. Whenever somebody has hallucinations, we want to make sure that we rule out causes that are not Parkinson's disease. We want to rule out these other causes. So we want to make sure it's not an infection. Then there's also other external causes that can contribute to hallucinations. Medications are a big one. So some Parkinson's disease medications can actually trigger hallucinations. Levodopa, dopamine agonists, amantadine is a big one. Other anticholinergic medications. And then also non-Parkinson's medications, particularly bladder medicines are bad for doing this. Pain medicines, some of the other sleep medicines. These are other medications that can trigger hallucinations. Certainly alcohol, other recreational drugs. And in this day and age, we have to consider marijuana too, because that's legal in many states. And patients are trying that for sleep and for other issues. So we want to look for any external factors that can contribute to hallucinations. Even time of day, dim lighting, and evening time tends to bring out hallucinations. So we want to correct what we can. So let's talk a little bit more about what hallucinations look like in Parkinson's disease. So early on, very mild hallucinations may not really be fully formed hallucinations at all. Patients may have a sense of presence. They feel like someone's behind them or over their shoulder. They turn to look and nothing's there. They feel like there may be somebody else in the house, but there's not. So they're not actually seeing anything that's not there, just sort of a feeling. Okay? Other people may actually sense a little motion, like they'll see a little motion out of the corner of their eye, turn to look and nothing's there. Or they'll experience illusions. And an illusion is when something is there, but it looks like something that it's not. So this little slide here, it gives an example of that. There's maybe a pair of rolled up socks on the floor, but when you look at it, it looks kind of like a mouse. And you look again and you realize it's just a pair of rolled up socks. That's an illusion. So a common one that people tell me about a lot is if they're a passenger in the car and they're driving down the road, they'll see a child at the side of the road. They'll say, hey, watch out for that child. And they get closer and they realize it's a fire hydrant or maybe a mailbox. That's a common one we hear a lot from our patients. Sometimes bushes in the yard will look like an animal. They look again, realize, oh, it's just the bush, you know. So that's an example of an illusion. As symptoms progress, people may actually see formed hallucinations. And this is actually seeing something that's not there. In Parkinson's disease, the most common type of hallucinations are visual. So people will see things that aren't there, but sometimes they can also feel things that aren't there or taste things that aren't there, hearing things that aren't there, smelling things, sometimes even feel things or feel like their part of their body is tingling or has a strange body sensation. But seeing things is the most common. And people tend to see animals and children, people. One thing that tends to be consistent is these people or don't say anything. So I have a patient who sees people in his house and he says, if I'm not sure if they're real or not, I just go talk to them. If they don't answer me, I know they're not real. So hallucinations and Parkinson's don't tend to speak. They'll just stand there. Sometimes these are people that patients know. It could be a loved one. It could be someone who's passed on already, who's deceased, or it could be a stranger, someone they've never seen before. It really varies a lot. Other patients may see, again, a rabbit. They don't have a rabbit or a cat or a dog in the house, anything like that. Feeling things. I have a patient who actually will say at night he feels his dog lying across his feet in the bed. And this is a comforting feeling to him, but his dog passed away a few years ago. So he's just feeling something that's not there. Hearing things, people can hear things in Parkinson's disease, but it's not usually voices. It's not like other auditory hallucinations we may see in other diseases. In Parkinson's disease, it's more like background noise. So you may hear the radio on in the other room and nothing is there, nothing's playing, or you may hear a conversation going on when no one's talking. You can't quite make out the words. It's kind of like background noise. But I have a story that I share a lot about a patient of mine who would hear music. This is not uncommon, actually. I have a number of patients who hear sort of background music as part of their Parkinson's. And this lady complained, she said, I hear the same song over and over and over again. I hate this song. Just make it go away. And we tried some different things. We weren't having a lot of luck. And then one day she came in and I said, well, how's the music? And she said, oh, Dr. McGraw, it's a miracle. I prayed the Lord would take away this music. And I woke up last week and I still hear the music, but now it's a song that I love. So I hear the same song over and over again, but it's one that I like and I can live with that, she said. So I thought that was a sweet story. Sometimes people will smell things that aren't there. And that's an interesting one because a lot of people with Parkinson's disease lose their sense of smell. So they may not really be able to smell things regularly, but then they'll say, you know, but every now and then I'll smell smoke, even when nothing is burning. So you can really experience lots of different things. And this is just an example. In this picture, they're showing a man who's seeing children who aren't really there. Now, delusions are a little more complicated and complex. And delusions is when people experience a belief or they believe something that's not true. And there are different types. Persecutory delusions means that you think somebody is trying to harm you or steal from you or deceive you. For example, I have a patient who thinks the neighbors were spying on her. I have another patient who thought that a loved one was trying to steal from them, steal their money. One that is particular to Parkinson's, kind of unusual for Parkinson's, in Parkinson's, I should say, is jealous delusions. These are delusions of spousal infidelity. So a patient will think that their loved one or their partner is cheating on them. And this is really disruptive to the family because you can imagine that the patient is really upset because they think that their wife, for example, is cheating on them. And the wife is terribly upset because she can't believe her husband thinks she would be cheating on him. And then the kids are upset because both of the parents are so distraught about this. So it's really disruptive to families, and often it doesn't come up because people are a little shy. They don't want to bring it up, or they're embarrassed. They don't know it's because of the Parkinson's. They don't know it's related to the Parkinson's. So sometimes, we have to be on the lookout for this and try to let people know it's okay to tell us so that we can work on it. But this it's a little unusual outside of Parkinson's. It's something that seems to be particularly distinct in Parkinson's disease. You can also have reference delusions, and this may mean that you think a TV show or a news program is speaking directly to you. So for example, I had a patient when she watched the evening news, and whatever she heard about, she thought it was about her own person or her family. So she saw a car wreck, she'd think it was about someone that it related to someone in her family, and she'd get very distressed. This is a man who thinks, is concerned someone's watching him or trying to do something to him. And symptoms can certainly change over time. Early on, people may just have these illusions I talked about, the mild feeling of somebody being there or something moving out of the corner of their eye. But they know it's not real. It's usually not too distressing. People are okay. But then that can progress and become a more formed hallucination. But again, people know it's not real. Maybe it's not too distressing. But then over time, they lose their insight. They start to think that it is real. And even when their family tells them, oh, no, you're safe. There's no one trying to hurt you. Or no, nobody else is in the house. There's nobody in the living room. They don't believe it. So they can have more complex hallucinations. They can develop the delusions and not understand that it's not real. And that can be very difficult. One study showed that symptoms did tend to progress in most people over a 3-year period. So I actually think this slide is really important, as sometimes it's hard for people to know what is a hallucination and what is not. So hallucinations and delusions are not dementia. It's not Alzheimer's disease. People can have hallucinations and delusions in Parkinson's without dementia. They can have good cognitive function and still have these hallucinations. Also, Alzheimer's disease is a separate disorder from Parkinson's. It is different. And even if you have hallucinations, delusions, that doesn't mean that you're going to get Alzheimer's disease. Also, hallucinations are not dreams. This one comes up a lot. Vivid dreams are common in Parkinson's, and people can sometimes act out their dreams. So they'll dream they're in a fight and they'll start punching in the bed and kicking, and they might kick their partner and might even fall out of bed. We've seen that happen. But that's not a hallucination. That's a vivid dream or a dream enactment if they're acting it out. Sometimes if you're coming out of a dream, you come out of a dream and you're a little confused for a minute. You're trying to figure out if that dream was real or if it was really just a dream. And again, that's not a hallucination. That's a little dream-related phenomenon. Hallucinations happen when you're awake. Delusions happen when you're awake. I think that's a big important point that kind of helps people distinguish what's a hallucination. So who's at risk for hallucinations? About 50% of people with Parkinson's develop some form of hallucinations or delusions over the course of their disease. And that doesn't mean that everybody gets them to a severe degree. It may mean they just have mild symptoms, but about 50% of people experience some type of hallucination over the course of their Parkinson's. Now, we know that Parkinson's is related to dopamine. There's not enough dopamine in the brain, and that makes it hard to control the body. And dopamine deficiency is related to the motor symptoms people in Parkinson's experience. But Parkinson's is more complicated than that. It's not just dopamine. It also involves serotonin. And serotonin is another neurotransmitter, and it's thought to play a role in hallucinations and delusions. Now, there's several risk factors for hallucinations in Parkinson's. Having Parkinson's disease is the #1 risk factor for this, of course. Older age is another risk. The older you get, the more vulnerable you may be to these hallucinations. And how long you've had Parkinson's disease and how severe the disease is. Those are other things that increase the risk of having hallucinations. And of course, these are really distressing to the person who's experiencing them and to the family. But they're also a common reason for hospitalizations. So the number one reason people with Parkinson's get admitted to the hospital is because of motor symptoms, falls, things like that. But hallucinations and delusions are responsible for about a quarter of hospitalizations in Parkinson's disease. And also it causes a lot of increased caregiver burden. It makes things much harder for the caregiver or the spouse or the child, whoever's helping the person with Parkinson's disease. It causes a big increase in emotional distress for caregivers as well as for the person who's experiencing it. So this is a big impact on people. So how do we manage it? What do we do? Well, there's several approaches to treating hallucinations. First thing, as I already mentioned, we want to rule out external factors, rule out other things that could be triggering these hallucinations. So we want to make sure the person doesn't have a urinary tract infection. We want to look at their medications and make sure the medications aren't making this worse. We want to see if there are any triggers that we can identify. And then we start with non-pharmacological intervention. So we want to start with supportive therapy, reassurance, oh, it's safe, no, everything's okay. Sometimes redirecting people can kind of help break the hallucinations. Making sure all the lights are on and things are well lit in the day and increasing sunlight exposure, all those things can sometimes help clear up hallucinations. Correcting vision, correcting hearing can help. So we want to do all those things first. Then if that's not enough, we may have to reduce some of the Parkinson's medications. We may have to reduce the ones that are most likely to cause hallucinations and just use the simplest, lowest doses we can get away with. But we often can't completely lower Parkinson's medicines because people need those to be able to move. So we have to balance the need to move and control the motor symptoms with the need to minimize side effects and hallucinations. And then finally, if those measures aren't successful, then we need to talk about adding medications to control the hallucinations. Prior to 2016, there were no FDA-approved treatments for hallucinations, and we made do with what we had. And then that changed a few years ago. The most important thing to do is actually just make sure you're talking about this with your physician or your nurse practitioner, whoever manages your Parkinson's disease. About 80 to 90% of people don't bring this up with their visits with their doctor. And if we don't know what's happening, we can't treat it. So I really encourage patients to bring it up. We, in my clinic, because we're so focused on Parkinson's, we ask several questions at every visit. And one of those questions is hallucinations. We ask, are you having any hallucinations? Do you see things that aren't there? Do you ever see something out of the corner of your eye, turn to look and nothing's there? Do you think anybody's trying to hurt you or deceive you? So we always inquire, but not every center does that. So we also encourage patients and caregivers to bring it up. So if you're a patient and you actually see things that aren't there, bring it up. Tell your doctor, tell your loved one, ask them to bring it up. Or double check with them. Hey, do you see those children in the yard or not? You know, you can double check. If you're a caregiver, if you're a spouse or a child of someone with Parkinson's and you care for them, if you see them acting in a little different way, if you see them reaching for things that aren't there or talking with people aren't there, or they seem fearful, you know, ask what they're experiencing. And if you're not sure, you know, bring it up with the doctor because we want to be able to help, but we need to know about it in order to be able to help. So like I said, some offices are going to ask about this regularly, others are not, and they may be waiting for you to bring it up. So please, you know, I always encourage patients, make a list before your doctor's appointment. Write down the 3 things that are bothering you the most, or write down questions you have, or if something is happening and you're not sure what's going on, write it down so you remember to bring it up during that visit. So once you talk with your doctor about this, then you can learn a little bit more about it. So you'll know what it is. And a lot of times it's not as scary if you know what it is. A lot of people are surprised to find out it's related to their Parkinson's and that there are things we can do to help. It doesn't mean you're crazy. A lot of people say, I don't want to bring this up because it sounds crazy. It doesn't sound crazy at all. We deal with it all the time. And like I said, we try to help. So bring it up and then talk about a plan to either watch it or monitor it or intervene and treat it. So just to summarize, about 50% of people with Parkinson's do develop hallucinations or delusions at some point. Visual hallucinations are the most common, but other types can occur as well, and they may change over time. So what starts off as mild and not bothersome can progress and become more of a problem. It just depends on the person. And we want to make sure that you bring it up with your doctor and your caregiver, your family. So the next part of the talk, we're going to talk about NUPLAZID, which is a treatment, the only FDA-approved treatment for hallucinations and delusions associated with Parkinson's disease. Now, NUPLAZID is classified as an antipsychotic, and medicines like NUPLAZID have been associated with an increased risk of death in older people, who have psychosis or dementia. And it's important to note that NUPLAZID is not approved for the treatment of patients with dementia-related psychosis, except for in the case of Parkinson's. So it is approved for the treatment of hallucinations, delusions in Parkinson's disease, but not in other diseases. Like I said, it is the only approved treatment for this disorder. Like all drugs, we don't know for sure why it works or how it works, but we think that it works through the activity of serotonin in the brain. I mentioned that earlier. So of course, they did a large study that led to the approval of this drug. And in the large study, the majority of people who took NUPLAZID experienced a significant improvement in their hallucinations and delusions. Now, some people didn't experience any improvement, and some people even got worse, because unfortunately, this is not a magic wand or a cure. This is a medication, and all medications have pros and cons. But the majority of people who took this medication did have significant improvement. In general, I always tell patients this: it's not going to work overnight. It takes several weeks to have benefit. We tended to see improvement in about 4 weeks, but some people it may take 6 weeks to really see improvement. It's important to know that going into it. Now, what's unique about NUPLAZID is that it does not worsen motor function compared to placebo. Many medications out there can worsen Parkinson's motor function, but NUPLAZID in clinical trials did not worsen motor function. And you can take it without adjusting the doses of your carbidopa, levodopa, and other Parkinson's medications. Now, of course, it does have side effects, and these are listed here for you. The most common side effects with NUPLAZID are nausea, swelling in the legs or maybe arms, feeling confused, hallucinations, constipation, and changes in walking. Now, a lot of people say, wait a minute, isn't it supposed to help hallucinations and confusion? Why is that a side effect? And that's just because everybody is different. And, most people had improvement, but some people did actually have worsening symptoms, in which case this is not the right medication for them. So I always tell all my patients, whenever starting a new medication, if you feel anything different, anything gets worse, call me right away. Let me know and let's talk about it and decide if it's related to the medication or not. So it's important, again, to stay in communication. Now, there are some people who should not take this at all. If you're allergic to it, you shouldn't take it, right? That may sound obvious, but it's important to point out. Also, there are certain people who have abnormalities in their heart rhythm that could worsen if they take NUPLAZID. So if you have heart conditions that change your heart rhythm, or if you're on multiple medications that could affect your heart rhythm, we look at something called the QT interval, which is a change in EKG. So if you're on multiple medications that could prolong that QT interval, then we would recommend not adding NUPLAZID or other medicines that add to that risk. So it's, again, something to just make sure you're talking to your doctor about. So make sure your doctor knows if you have any heart problems, and also make sure that your doctor knows all the medications you're on. This is a big one. I always tell people, bring in the bag, bring in all the bottles. We'll look at them with you and make sure that we know everything that you're on, including over-the-counter medications and herbal supplements. How do you take NUPLAZID? It's a pretty straightforward drug as far as dosing. You just take 1 capsule every day. How do you get it? So the company that makes NUPLAZID is Acadia, and they have a program set up to help people get NUPLAZID, help figure out insurance coverage and cost and benefits to try to make it as available as possible. So to summarize, NUPLAZID is the only FDA-approved prescription treatment for hallucinations and delusions associated with Parkinson's disease. And in the study, the majority of people who took it had significant improvement, had fewer or less severe Parkinson's-related hallucinations and delusions. It had no effect on motor symptoms. In other words, their Parkinson's symptoms didn't get worse. And it can be taken without adjusting medications. Common side effects. This is where it sounds like a TV commercial. Common side effects include swelling in the legs, arms, nausea, confusion, hallucinations, constipation, and changes in normal walking. And we normally have a little story here that is nice, but I don't think it's working. Oops. Yeah, sometimes videos don't work, unfortunately. So we'll have to skip that. When I talk with people who have hallucinations, I think the important things are to work as a team with your family, with your caregiver, with your doctor, and do everything you can to improve these symptoms. We can't always make them go away, but we want to minimize them as much as possible. And I always tell people, my goal is to improve people's lives with Parkinson's. We don't have a cure for Parkinson's yet, even though I hope we will one day, but we want to do everything we can to make people's lives better. So with that, I will end and open it up to questions. If anybody has any questions about NUPLAZID, about psychosis, hallucinations, or about Parkinson's in general, I'm happy to answer.
We have a quiet group today, Dr. McGraw. You did so well. You covered everything.
It means I explain things well. I can
You
hope.
did very well.
I can hope.
I don't know if we can get to the gallery to see if any.
Yeah. Or I can unmute everybody.
Yeah. Let's still have some people on so we can see if they have any questions. And they can put in the chat as well. I'm not seeing anything coming in on chat. Well, I guess we're good to go, Dr. McGraw.
Well, thank you very much. Thank you for having me. Thank you for tuning in. I hope you learned something.
Thank you so much. And thanks everybody for joining. Have a wonderful day.
All right. Take care.
Take
Bye.
care. Bye-bye.